नमस्ते, हेलो एवरीवन। मैं हूं आपका आयुष यानी बीएच गाइड। आज के वीडियो में आपका स्वागत है। आज हम डिस्कस करने वाले हैं एएसी चैप्टर के बारे में। जैसे कि पहले ही हमने कहा था कि आयुर्वेद हॉस्पिटल एक्रेडिटेशन के सारे स्टैंडर्ड्स हम वन बाय वन डिस्कस करेंगे। उसी में से ये पहला वीडियो है जिसमें हम चैप्टर 1 एएसी डिस्कस करेंगे। यहाँ पे इसमें 14 स्टैंडर्ड्स है। हर स्टैंडर्ड को हम समझने की कोशिश करेंगे और उसे इम्प्लीमेंट कैसे करना है ये भी देखेंगे। पहले स्टैंडर्ड में है ऑर्गेनाइजेशन डिफाइंस एंड डिस्प्लेज द सर्विसेज दैट इट प्रोवाइड्स। ऑब्जेक्टिव एलिमेंट्स में आपको क्या करना है, पहले एक लिस्ट बनानी है जो भी आप सर्विसेज प्रोवाइड करेंगे। उसके बाद उस सर्विसेज को आपको प्रोमिनेंटली डिस्प्ले करना पड़ेगा हॉस्पिटल में। एंड थर्ड इज ओरिएंटेशन प्रोग्राम, सो यू कैन take pen and paper and note down wherever necessary. That is, this is the first training you should give to the staff about the services provided by the hospital. So very easy first standard. With these three things, first standard will be implemented. Next, in second standard, well defined registration and admission process. सो अब डॉक्यूमेंटेड पॉलिसी एंड प्रोसीजर होना चाहिए रजिस्ट्रेशन और एडमिशन का, जो आपको सिमिलरली एज इट इज़ फॉलो करना है। इन केस ऑफ डिफरेंट काउंटर्स फॉर ओपी पेशेंट, आईपी पेशेंट, इमरजेंसी पेशेंट, सेपरेट डॉक्यूमेंट ऑफ पॉलिसी एंड प्रोसीजर होना चाहिए। सबसे इम्पोर्टेंट यूनिक आइडेंटिफिकेशन नंबर आपको जनरेट करना पड़ेगा। ऑलरेडी आप कर रहे हैं तो it is well and good, otherwise you have to give a UID number to all the new patients। और वहीं पेशेंट को एक्सेप्ट करना पड़ेगा जिनको आप सर्विस दे सकते हैं। एंड ऑल्सो द पेशेंट्स in case of non-availability of beds, how they are managed should be documented. Like in ICU or NICU, bed is not available, or in a particular department ward bed is not available. In that case, what is done, that is documented, and same should be given training to the staff. So this is the second orientation or training program which should be given to the staff. And maintenance of bed occupancy on daily basis there should be, so that we can know the availability of the bed, and also monthly. So these are the two registers. One is bed occupancy daily and monthly. So with these things the second standard will be implemented. Next, in third standard, mechanism for transfer or referral of. So this standard is related to transferring a patient to other hospital. In that, first is regular transfer. For that, documented policy and procedure should be there. And in case of stable and unstable patients, that should be also documented. And the staff responsible for this process should be identified, and a training should be given to them how to handle the transfer. And while transferring, hospital should give a summary with patient condition and treatment given. So there should be one standardized format for this referring sheet. Next standard is regarding initial assessment. So a definition of initial assessment or content of initial assessment has to be decided for outpatient, inpatient and emergency patient. And who will perform the initial assessment? Like in OPD, the doctor himself will do initial assessment. In IPD, sometimes doctor can do, or a duty doctor or PGs can do. Accordingly, you can write in policy and procedures, and also within which time frame it will be done. So usually for IPD patient it should be done within 24 hours, but in many places it is done within 1 to 2 hours after admissions. So with these the standard 4 of AAC chapter will be implemented. Next standard is initial assessment including screening, that is in AAC 4 only. What initial assessment contains, so in that nutritional needs will be there and care plan. So clear care plan, in that you have to write the treatment, expected cost of treatment, expected outcome of the treatment, possible side effects, and also alternative treatments. And this should be countersigned by the doctor within 24 hours. Next, AAC 5, that is organization undergo a regular reassessment. Like daily rounds, it is reassessment. So standard reassessment or rounds is 2 or 3 depending on your practice. So you can make it 3 rounds, that is reassessment. And in case of OPD, you have to write for the next follow. So during reassessment, care plan has to be monitored, and if required, it is modified. So clinical care document reassessment should be given, or training is given regarding that to the duty doctors, and their treatment plan may be changed accordingly, or the patient may be discharged in the reassessment processes. Laboratory services, it should be applicable, or it should be in the scope of the services of the organization. Second is adequate qualified trained persons should be there for the laboratory service. There should be documented policy and procedure which guide the collection procedure, identification, handling, safe transportation, processing, and disposal of specimen. So a standard process, that is SOPs, you have to make for this, and that we have to follow. Then a time frame should be given, that within this time the laboratory results will be available. Like sample taken in morning between 8 to 10 or 8 to 12, the results will be available by 2, like that. It should be included in the policy procedures. In some cases where there are critical results, that should be immediately intimated to the person concerned. So critical result should be defined, and a process is made to inform the same to the treating doctor. Then laboratory tests not available in organization are outsourced based on the quality assurance system. Next standard is established laboratory quality assurance program. So what it means, in that there should be one verification or validation of test methods. How the tests are done, that should be verified. Also there should be one surveillance of test results. Test results are checked. In this, in periodic calibration and maintenance of all equipment should be there. So there should be registered maintained for this, so that we can know the which instruments are calibrated when. So this is like quality assurance program. Also in some cases, what corrective and preventive actions are taken wherever you find any error, that should be documented. So this is regarding AAC 7. Next is established laboratory safety programs. So that should be documented. Documented means what? What you are going to follow for safety is noted down. So the program should be guide the handling and disposal of infectious and hazardous material, and the persons in the laboratory are trained for safe practices. So this is also one training you can note down. And the laboratory persons are provided with appropriate safety equipment or devices. Next is imaging services if available in the hospital. So they should comply with the legal and other requirements. That is, the document should be clear in legal and other requirements, and it should be incommensurate with the organization's services. The infrastructure is adequate to provide for its defined scope of services, that is, physical infrastructure and the manpower. There should be qualified and trained persons for these services, and there should be documented policy and procedures which guide identification and safe transportation of patients to imaging services. So same policy and procedures you have to follow. Then results will be available within a defined time frame that is to be documented, and that should reflect in the practice, right? Like after taking image, time should be noted. After giving results, the time should be noted. That will give you the time required for the result. Then critical results, as in lab, also it should be immediately informed to the concerned person, and they should be reported in the standardized manner. And which are not available in the hospital, they are outsourced if required. The next is established quality assurance program. The quality in the imaging services has to be documented, in that there should be verification and validation of imaging methods, then surveillance of imaging results, periodic calibration and maintenance of all equipments, and documentations of corrective and preventive actions taken. So this is simply the quality assurance program for the imaging services. Then radiation safety program, also it should be documented. It should be integrated with the organization's safety program, in that if any such radioactive or hazardous material are used, so there should be handling, usage and disposal methods defined. Imaging personnel are provided with appropriate radiation safety devices. Radiation safety devices are periodically tested and documented. Imaging personnel are trained in radiation safety measures, and imaging signage are prominently displayed in all appropriate locations. In this, the radiation safety devices which are periodically tested are outsourced. Next standard is patient care is continuous and multidisciplinary. So during all phases of care, there is qualified individual designated as responsible for the patient care. Care of patient is coordinated in all care settings within the organization. Information about the patient care and response to treatment is shared among medical, nursing, and other care provided. Information is exchanged and documented during each staffing shift, between shift, and during transfer between units or departments. The patient's records is available to the authorized care providers to facilitate the exchange of information. Documented policy and procedures guide the referral of the patient to other departments or specialty. So simply it means the IPD case sheets should be correctly filled wherever doctors see, or by all the departments. By seeing the paper, everyone will get the detailed condition or treatment or response of the patient to the treatment. So it will be helpful in planning the next treatments. Next is the organization has a documented discharge process. So how a discharge is given or content of discharge is to be documented in policy and procedures. So in case of LAMA discharge also, consent should be given, and a discharge summary is given to the patient leaving the organization. So regarding discharge summary, or care plan, nutritional assessment. A dedicated video is available. You can see in the I button, and you can take the help of those videos. Organization defines the content of discharge summary. So this is the AAC 14, as already discussed. A separate video is there. You can see that. In that, time of discharge should be there. Patient name, UID number, date of admission and date of discharge should be there. Reason for admission, findings, diagnosis, patient condition at time of discharge. Also, it should contain investigation results, any procedures performed, any medication administered, or other treatments given. It also contains the follow up advice, medication, and instruction for when and how to obtain a urgent care. Also, in case of death, the summary should include the cause of the death. So, the present discharge summary what you are following does not contain all these details, so you have to modify them as per the required for NABH guidelines. So, this is the first chapter of AAC in Ayurveda Hospital Standards. Keep watching and don't forget LSS. Thank you.